thank you so much for joining us today. My name is Carrie Scott. I work for Spruce Health, and you are joining our webinar on practice management and how to use Spruce as a vital tool. On our next slide, I will quickly show you what we have lined up for the day. Here's the agenda. So we're going to be covering how to use Spruce as a supervisory training tool, how to create consistent messaging, how to build a culture of transparency, and you're going to get an inside look, a first look at our new beta reporting feature, which is pretty exciting. We are going to save time for questions from the audience at the end. So please do use the chat and Q&A function at the bottom of the screen to send any questions that you may have our way. I will be fielding those and serving them up for Michelle so that she can answer them as we get to that part of the program. I will quickly introduce Michelle on our next slide here. Michelle is our implementation specialist. She is also a former practice manager, so she knows quite a bit about this subject, and she's a Spruce expert. So it makes her the perfect candidate for leading this discussion today. And with that, I am going to pass the torch and let her get started. I'm going to hide myself and I'll jump back on when it's time for Q&A. So everyone buckle up and enjoy. Michelle has some really interesting content for you guys.
Thank you so much, Carrie. I just want to start for those of you who may be new to Spruce, telling you just a little bit about what Spruce is so that you have some context for what I'll be showing you today. Spruce is a communications platform that is designed for medical professionals and is HIPAA compliant. So this is your full communication platform for everything you need for your practice, everything from fax and phones to texting and secure messaging. So this can be one unified solution for your practice. And we also feel that this is really vital for internal communication and practice management, as we're going to talk about today. So my background, as Carrie said, is as a practice manager for a larger mental health company. So Spruce is something that I used in that role as a practice management tool. And it's also something that our team uses internally. So I'm also going to share with you today a little bit about how we use our own product internally, so you can see that we are really, familiar with this from both sides. So first, we want to talk about supervision and training staff using Spruce. So for those of you who have been using Spruce, you may already be familiar with the concept of the internal note, the internal side of your conversation thread with the patient. So this feature in Spruce really allows supervisors, whether we're talking about the administrative team or your clinical team, to be able to both draft possible responses and also comment upon a staff member's responses and give feedback that is an actual real-time response and can help to guide future behavior. So in this example I have created here, we have someone who is a new receptionist reaching out to a patient who has asked for an appointment. And they have said here, I'm happy to get you an appointment. Dr. Brown is available tomorrow or Thursday. And you can see that the practice manager, who we're assuming in this case is this person's supervisor, has reached out internally and paged the receptionist, which is a way of giving them an internal notification saying, great job, you jumped on this right away. In the future, it's not our policy to offer next day appointments. And, you can always reach out to the clinician internally and ask when they might like to see this patient, or if they have, a specific time in mind. But, we would like you to offer 3 times that are not next day. And that's how, how we would like to run this type of communication. So you can see here that this offers feedback in a real-time way so that this receptionist can change their messaging in the future. It's also feedback in this case that's probably visible to anyone else in the team and can help other members of the team who may also be new or, maybe unclear about this policy. And so you have this, open communication here. This is also something we see as really valuable for clinicians who are under supervision. So you might see a trainee therapist, for example, write something internally first saying, hey, I'm thinking of responding to the patient's question with this, and paging their supervisor to say, hey, what do you think of this response before I send it to the patient? Do you have any edits? And that really allows the supervisor to be very intimately part of that communication without it being something that is visible from the patient's viewpoint. So I also have this screenshot on the right here, which is showing from a mobile view what the patient is seeing. So you can see that this whole internal block is hidden from the patient. Okay, did also want to share how Spruce uses our own system internally to do a similar thing. So many of you may be familiar with writing to the Spruce support team on our support thread. And our support thread looks like a Spruce thread with a patient would look to you, except that in this case, you as the organization, as our customer, are our patient. So something that we often do as a team is troubleshoot internally before sending a message to the customer. So in this case on the left, you can see that I was asking a question because I didn't understand how to fix something for this customer. And I wanted to make sure that other members of the team reached out and let me know so that I could learn also. So this is a great way for somebody who's new or who's learning a new role to really have a lot of experience with customer communication and training in a real-time way. So we just want to be transparent that this is what we do too. And, so from our experience, we also know that this is very effective. Okay, another tool that is fantastic for managing how your practice is running is the saved message. So many of you may be familiar with this. If you're going into settings and saved messages, you can create new saved messages. And you can access these in a conversation by typing a period and then the name of the saved message, and you'll see it'll come up in a drop-down menu. So some sample use cases of this: sharing practice policies. This is something I did very routinely when I was a practice manager, but it's also something that I trained my staff to do because it's often incredibly important that patients receive really consistent messaging. So, for example, your late cancel policy. You want every possible communication about this to be totally consistent so that patients really understand and don't feel like there's, unnecessary wiggle room. So using a saved message so that this is always the same is really helpful. Templated scheduling messages or appointment reminders. I do want to point out that Spruce does not link to your clinical calendar. So it's not possible to schedule based upon the time in your calendar that the patient has an appointment, but you are able to schedule messages manually within Spruce. And using templated messages where perhaps your saved message has blanks in it that your staff have to fill out before sending can also make sure that this is done consistently and the same information is always being given. Intake paperwork and other kinds of forms that you might want your patients to fill out can be attached to a saved message. So that can also be a fantastic use case for this. Sending Spruce visits. If you're unfamiliar with Spruce visits, this is something that can be sent through secure messaging, and they are interactive forms such as the BDI or PHQ-9 or COVID questionnaires that we've already created so that you can use them and send them to your patients. That's a fantastic use of saved messages if it's something you're doing very frequently. And troubleshooting information, I put this in just again to say, like, this is something you may see on our Spruce support thread pretty often. If you write in and say, hi, I have this problem with video calls, one of the first things you might get in response is a saved message that gives troubleshooting instructions, because this is something that, we want to make sure we're always giving the same consistent information. Request for a refill is another great one for this, because many practices find that they have a set list of questions they always have to ask their patients when they're asking for a refill. Like, what is the dosage of the medication? Which pharmacy are you sending it to? Which clinician is your prescriber? And just having that as a saved message is really helpful for your staff, especially as you're growing and you have more and more staff who might be communicating with your patients, and you want to make sure you have that level of consistency. So this is just the mobile view of using a saved message. So you can see in the first image that you're starting to type in PHQ, because this is the name of the saved message, and you can see that it's popped up there. And then when you click on it in the second image, you can see that it autofills. And then you can see in the third image how this looks after it's sent. And that saved message contains a Spruce visit, the PHQ-9 rating scale. So you can see how that looks once it's been sent as well. Right. Transparency versus privacy. So Spruce is a super customizable platform. You can have a lot of different levels of privacy within the platform, depending on how you want your practice to be run. There are some practices that really want clinicians to have private conversations with patients that are not accessible to the rest of their team. This may not be the right solution for your practice, but if it is a solution that you're interested in, the way to set this up is to have separate Spruce links and separate phone numbers for those clinicians to have their own conversation threads. So I just wanted to showcase how this looks from a patient perspective and also from the clinician perspective, so that you can think about, whether this is something that might be right for your practice. So on the left here, you'll see the patient's view of their Spruce app, and you can see that they have two different conversations. And next to that, you'll see this is their private conversation with their clinician. The clinician has reached out and says, this is a private conversation thread you can use to get in touch with me. And they're sharing clinical information here that maybe they don't want to share on the general thread that the entire team can see. On the right, you can see the info panel for this particular conversation from the doctor's perspective. So you can see that the doctor can see who this conversation is between, and can see that the only additional internal member is this other doctor, who in my pretend world, I'm saying is the supervisor. And we've made the decision as a practice that this supervisor should be able to see the conversation as well. So having this level of restriction may not be the right thing for your practice, but I wanted to showcase it here so that you understand some of the ways that this can be customized, because as you're thinking about setting up your practice or changing the setup that you have, it's important to imagine from the cultural perspective of how your practice is operating, what sorts of restrictions make sense and how that impacts everyone who is working together. So in talking about transparency versus privacy in shaping culture, an example that I'd like to give is actually from my own experience working as a practice manager. The practice that I was part of had a team lavender. This is a concept that might be more familiar to those of you who have worked in hospitals. Team lavender is often a group of clinicians or other staff who have volunteered to be on call in crisis situations that affect clinicians within the practice. So in some cases, that might be clinicians who have had a patient pass away. It might be a different kind of crisis that's common in that practice situation. Because I worked for a mental health company, often the kind of crisis that we were specifically dealing with might relate to a patient attempting suicide. So the procedure that we had in place that I've put in this image for to give you a sense of how this would work for our practice is that the receptionist has received a call from this patient's spouse. And they said the patient's spouse has just called the main line and let me know that they have attempted suicide and are currently at NYU Hospital receiving medical care. You can reach the attending doctor, Dr. Smith, at this number. Now, in this situation, we had trained reception that they should not post this in any thread that was visible to a larger group of the team. It was important that this kind of communication be private and be something that could be handled correctly without it becoming a larger crisis throughout the whole team. So what they've done is they've created an internal note that is attached to this patient's contact card, and they've limited the membership of that note to themselves and Team Lavender. And they have paged Team Lavender, so Team Lavender can now handle the situation from here. Now, I think that this is an important example of how privacy can be really important within the team, in the same way that privacy in any aspect of your life is going to be important in some situations. So I think what's wonderful about Spruce is the ability of the people who are running a practice to really think about privacy and transparency and how it's shaping their company's culture, and really use like the granular control that exists to purposely shape that culture. So team conversations, which you may also be familiar with, also can have the membership of the whole organization or specific teammates. And you can think about whether you want teammates to have private conversations with each other or small groups, or if that's something that you want to discourage within your practice. You can think about whether you want to make team announcements of some kind in a team thread, or if you want to have team threads that are designed for discussing specific issues. Spruce, by many practices, is used as kind of a HIPAA compliant Slack. And we really encourage this kind of internal communication because Spruce is something that really can keep everything in your practice organized and allow you to have the kind of coordination that you want in a safe and secure environment. Okay, I'm going to move on to discussing our beta reporting feature. Now, I want to stress that this is still in a testing mode for us. It's not something that we are able to make widely available right now. If you're interested in this, we would love to hear that you're interested in it. Please let us know. It's important for us to gauge that interest. But for right now, because the system that we use to produce these dashboards is not yet, let's say, ready for its close-up, we're not offering this as a paid product yet. It's not something that we are widely offering to all practices, but I'm excited to give you a bit of a sneak peek into this because I think in the future, it's going to be really fantastic for practice managers. And we would love to hear more about what you would want to see in this feature. So the first chart that we have here shows inbound communication by channel for each unique person. And you can see that it shows people who called, messaged, emailed, sent standard SMS texts, and people who sent faxes. So this can just give you a sense of how are your patients communicating and how much engagement are you getting. The bottom chart here is the call answer rate for the last week, which is a great tool for practice management. And I did actually steal this from a real practice. And if I were the practice manager, I would be curious about why on July 5th, none of the calls were answered. Were all of the receptionists on vacation on July 5th? Or were they technically working, but actually on vacation? So this is great information for a practice manager to be able to have some insight into how things are running from a really quantitative perspective. So the next charts that we have here are breaking this down a bit more. So you can see the SMS that are sent and received, the secure messages sent and received, video calls completed, and scheduled messages. So again, this is just giving you more information about how your practice is responding to patients, what's working, what's not, where you're, really seeing a lot of engagement. This is my favorite. This is the call heat map. So I love this because for many practices, and actually this is not true of this particular one, but for many practices, a lot of their calls come in right at noon. And this is so important for you to know, because if your receptionist goes on their lunch break at noon every day, and that's when all of your calls happen, it is worthwhile to say, hey, you should go on your lunch break at 1. And it's that kind of simple adjustment to your practice that can ultimately make a huge difference in the patient experience of how they're reaching you. So this is also really important when you're growing as a practice, because if you're saying, hey, I'm going to hire another person and all of your calls are coming in the evening, then it might be worthwhile to have that new person specifically working in the evening. So this also gives you a lot of really useful information. And this last one that's included in the standard dashboard that we've built right now is broken down by teammate. So you can see that on the left-hand column there, this is all blanked out because this is a real org and we don't want to share their actual names. But this breaks down the amount of communication that each of these teammates has had over the last week. So this is also really vital as a manager when you have, for example, 3 receptionists and you look at this and only one of them is sending any messages. This is very important for you to know as a manager. So this also is something that I think is going to be really useful for practices in the future. And finally, I just wanted to reveal to everyone that the support team at Spruce also keeps track of our data in terms of how we're sending messages to customers. And this is something we actually discuss on a weekly basis to think about how communication is divided between different team members, make sure everyone is pulling their weight. And you can see on the left here, these are my numbers for the last 4 weeks. And Spruce support is not a core aspect of my role. So actually, having there be very high numbers for one of those weeks may indicate that I'm not getting other things done, but it's good to know. And then you can see for the whole team, how many messages are being sent out. And I ran this yesterday, so this has low numbers so far for this week, which of course will climb as we continue. But you can see that this is how much we're engaging with our customers on a weekly basis, and one of the ways that we are keeping track of that. All right, I'm very curious to hear what questions people have.
This is so great, Michelle. I have to tell you, our chat is blowing up with people saying, sign me up. for this reporting feature. Everyone is saying they've been dreaming for insights like this. So it's pretty incredible. And I think it shows that we're all pretty hungry for the data. Yep, more of it coming in. They're loving the reporting. I think we're going to have a lot of raised hands here. So good stuff on that front. Let me start with some of the pointed questions that have come in. I'm going to start at the top because early bird gets the worm, right? So here's a question that goes back to closer to the beginning of your presentation regarding saved messages. This question asks, can you create saved messages on both the mobile device and desktop?
Yes, you can create saved messages on both, and you can use them on both.
Perfect. Perfect. Here is another question. This one is with respect to Spruce visits. The question is, are there templates of forms that could go out to the patients within Spruce? If not, how do you add one into Spruce? We provide mental health care.
So I would first tell you to look through the existing library of Spruce visits to see if there are forms there or rating scales that are important for your practice that you might want to use. What we have there are all things that are standard. So they wouldn't be specific to your practice, but there is a very large section of mental health rating scales and things that are available. So I would definitely look first and see if what you're looking for exists. If you're looking to send some kind of form that's specific to your practice, you can add that to a saved message as a PDF or as a link if you have some other system that patients can use to fill that out. And then that, that link or that PDF would go out whenever you were sending that saved message. If you have something that you think would be useful to other practices and you feel like it should be added to the Spruce Visit library, definitely let us know. We're always curious to hear what else people would like to have added. And sometimes we can accommodate it. It's usually more based upon copyright rules, whether or not it's allowable for us to be using a certain form. So that's typically our restriction, but we do definitely want to hear from you if you have thoughts on that.
Perfect. That's great. This is one that came in that's asking if you have any tips on how to optimize the fax feature within Spruce.
I'm not sure, what optimize means to you or exactly what you're hoping to do with the fax feature. One thing that's a relatively recent development that I love is that you can edit your fax number from settings to have a specific owner and have those faxes auto-assign. So if your practice is using assignment, which it may or may not be, but if you have like an assigned to me folder and you're using assignment, and maybe there's only one person in the office who's dealing with those faxes, you can have them auto-assigned to that person so that they're skipping the main inbox. And I think that's a really nice organizational feature for fax that I've definitely suggested to a lot of customers.
That's great. Thanks, Michelle. This is a question that I am not sure that I understand, but you may, but if you don't, we'll have Julia just give us some clarification. She's asking, is there a way to see the list of outstanding pages and pages completed by patient and by employee?
So let me say first that pages are meant for internal communication and patients don't have pages. They don't have the concept of pages from their end at all. This is something that you're using internally as a team. You can see your list of unresolved pages under the Pages tab, which is underneath your inbox. You are not able to see your teammates' pages. And this is something that has been brought up to us as a question about coverage and also as a question about offboarding. So we're definitely aware that there's interest in seeing other people's pages. And I agree that it would be a really useful management tool. So that's something that we are aware of and thinking about the best way from an engineering perspective to build that into the product.
Perfect. That's great. Here's a question. We have a company policy that staff members must return calls and/or texts by the next business day. What are your suggestions on how to track that easily, specifically identifying which staff member needs to get back to a particular patient?
Yeah, I think this question is a little hard to answer without looking at your unique setup, because part of my question there would be, is everybody using the same phone line, or are you using distinct phone lines? Are you assigning conversations so that we know who is supposed to get back to someone? Or are you using a different internal process like paging the person who's supposed to get back to someone? There are different ways that you might be doing that. If you were using assignment, for example, you would be able to set up a folder that showed who all of the conversations that were assigned to a team member, so that you could monitor what conversations each team member had outstanding. And that's something you would do by adding a conversation filter and adding it as the condition of assigned to that team member. So that's one way that you might be monitoring communication from that's assigned to different people. If you're doing this with tags or you're doing it in a different way, you could also, set up filters so you had some visibility into what people had outstanding. As I said, the one thing you're not going to have visibility into is those unresolved pages. So if you're doing this specifically by paging people to get back to someone, that's going to make it a little more complicated for you to be able to manage based on that restriction in the system right now.
Great answer. Just a quick PSA for all those folks writing in asking if you can get a copy of the webinar recording for yourself or teammates who couldn't join. Yes, in fact, this is being recorded. And shortly after we wrap up today, I will be sending the link to everyone that registered for today's event. So don't you worry about missing a thing. Dropping down, can forms within Spruce be signed electronically?
So if you're using a Spruce visit, then the output of this does record that the patient completed it and when they completed it. And we have a great video you can look up in our help center about Spruce visits, which will also show you how this looks from the patient perspective, which I think is really valuable as a clinician to understand what it is you're sending to a patient. In terms of other forms that you might have created yourself, no, Spruce does not have an e-signing capability within the platform. So if you were, for example, sending a link to something that was in a different program like DocuSign, that would provide that capability. But Spruce itself does not have that function.
Okay, perfect. Here's a question that's asking if Spruce is accessible via URL, i.e. desktop, laptop, computer, what have you, or if there's an app for patients. So I'll let you speak to the fact that we tackle both.
Yes, we do have both. Patients can log in on the web in the same way that you can log in on the web. You can do that through any browser. It's not a desktop app. It's something you're viewing through the internet, through your browser. We generally recommend Google Chrome, but it will work on any browser. If you have any issues with it, you can always let us know. And the app is available for both Android and iPhones, and that's free for your patients. You're only paying for your users of your account, your teammates.
Okay, perfect. All right, let's see here. Is there a way to have privacy on SMS messages or only messages from a secure thread?
Yes, you can have privacy on SMS messages based upon the phone number. So if you have clinicians who are sending text messages and you want them to be able to have those conversations be private, you would want them to have their own direct phone number. Spruce does not charge by phone number, it charges by user. So it is not an added cost to add a direct line for a clinician. And I have a video on setting this up that I would love for you to watch, because I think I've made it pretty straightforward. And I think it's a really great feature for a lot of practices that are looking for that kind of privacy.
Perfect. Here's one about EHR integration. Is there a way to link patients' conversations and information via cell phone to your EHR? And then, for instance, using Elation. I haven't found that feature. I'm able to do it via PC. So I guess they can do it via PC. Can you do it by phone?
Yes. So Elation is the one EHR that we have this integration with. And if you select a specific message on your mobile device, that's, if you see these three little vertical dots and you select those, one of your options will be to sync to Elation or to copy the message. On the mobile device, you're only able to do this with one message at a time. On the web, you're able to say select message and you'll see little boxes pop up and you can select multiple at once. This is also really valuable in terms of adding this information to any other EHR, where you can copy those messages and they paste very nicely into other programs with the date and time and the sender, so that you have all of the needed information for your documentation. I would also suggest that if you want to make sure that you personally can get back to the conversation, you can copy the conversation link from your Spruce account. The whole conversation link from the top right, there's a little icon that's the link. And you can put that into your EHR. And if you click on that link from your EHR, if you are signed into Spruce, it will open up that conversation. But that link will not be useful to anybody who is not signed into your Spruce account. It'll only be usable to you and your teammates.
Perfect. Here's a question about how to find the Spruce library. I'm guessing that's a question about our help center. And that link is actually linked out from the resource slide in this deck, which I will be sending after the event today. So sit tight for that. Otherwise, you can go to help.sprucehealth.com and you can find any document that you need there. Here's a question with respect to accessing Spruce. Is it US only, or can you access Spruce outside of this country?
You can access Spruce outside of this country. The caveat to this that is important to understand is that Spruce has two-factor authentication. And at this time, it is only set up to do this by SMS message to your cell phone number, which is linked to your account. So if you are trying to log into Spruce and you're outside of the country, you need to still be able to receive that SMS message for two-factor authentication. If you're trying to set up a new teammate, for example, like a virtual assistant who is outside of the country, they'll need to have access to a 10-digit US phone number to be able to get that two-factor authentication. This is a security feature that we feel pretty strongly about. In the future, we would like to offer other ways of receiving that two-factor authentication, because we are aware that this international issue is something that comes up more and more. But at this time, it has to go through SMS. And so you are going to be able to, you are going to need to have access to that message.
Perfect. That's great. And we do have an article in the Help Center about this very thing and how to create Google Voice as a, for instance, as a workaround. So please be sure to dig into that if you'd like even more info on that. Here's a question. Can you create extensions as opposed to separate phone numbers?
So don't want to get too much into the weeds of this.
Yeah.
I'm guessing that the question is coming from a place of, we don't want to change the patient experience. We want them to be able to call our main phone number to get their doctor, but we also like this idea of having private conversations. I could be wrong, but this is definitely something that I've had brought up to me before. So that might be the perspective you're coming from. And what we can do if you are using a phone tree is we can have the extensions from your phone tree link out to those direct lines for the individual clinicians, so that for the patient, they're still calling the same number they've always called and pushing an extension. It's just that what's happening on the back end is a little bit different, so that the clinicians are able to have those private conversations with a direct phone number. The caveat to this is that if the clinician is calling back from their direct phone number, the patient is going to see that direct phone number instead of the main line if they call back. And so it's something to think about in terms of how patients are going to interact with their clinicians, and whether you want them to have that direct line, or if you want clinicians to be always reaching out from a main line.
Okay, great. Here's one asking if you could just really quickly go over the basics of inviting clients to Spruce.
Definitely. So if you're inviting many clients at once, you can do this in bulk by going to contacts, and you'll see your full list of contacts. And you can either select everybody from the upper left, there's a box, you select all, or you could go through and select a group of them, or create a filter based on a tag for a group of them. And once you have them selected, you'll see this big blue button at the top that says bulk invite. And you would click on that, and it would give you a couple of choices for inviting that patient, just specifying the Spruce link that that invite is coming from, and you can fill in any kind of custom message that you want that person to receive. And from the patient perspective, they're going to get a link that takes them to the App Store and helps them to download that app, and they'll be automatically connected to your clinic. If they have any trouble with it, we're always happy to help. We do a lot of patient support. If you're inviting a specific contact, you can open up their contact card, which you might be doing by clicking on their name within the conversation thread. And you'll see if they're not invited yet, that at the top of their contact card, it has a big button that says invite to Spruce. And it would be the same process. It would just be for that individual.
Perfect. That's great. Here's a question asking, can you send bulk text messages in the event of an emergency?
Yes, you can send bulk text messages. The way that you would do this is selecting a group of contacts from your contact list. And then you'll see that right next to that bulk invite button, there is a bulk message button. And this is how you would send the same message to a group of people. This is not a group message. It's not a group text. This is a blast. So they're not seeing each other's information. They're all receiving the same message from you. And you'll see that when you select bulk message, it gives you the option of this being a secure message or an SMS. If not all of those patients have the app, you would need to use SMS, because the patients who don't have the app will not receive the secure message. And you'll notice when you're doing a bulk message that you can add attachments to that. So this is also something that we see people do a lot with, like their practice's newsletter where maybe they want to bulk message that out to all of their patients with an attachment of a PDF, something like that.
Perfect. That's great. I've had a few folks ask where they can find the library of templates for Spruce visits.
Yes, if you are going to send a Spruce visit, so if you had open a secure message thread with a patient and you select the little Band-Aid at the bottom, the little Band-Aid is the symbol for Spruce visits, and that will open up the full list of them, and you can look through them all and you can preview each of them and see what they look like. You can also set up a fake patient account for yourself. And I absolutely suggest that every clinician do that. It is always worthwhile to see how something looks from the patient's perspective and understand what that communication is for them. I think a lot of questions that we get often come down to you haven't seen it from the patient perspective and you're not understanding what it looks like for them. So this is a great way for you to really experience the product more fully. And not only can you preview these things and click through them, but if you have a fake patient account for yourself, you can send it to yourself, fill it out, see what it was like to fill that out, see how it looks on your end to receive it, and then you really have like more full information.
Perfect. Can we use Spruce to call from the computer or only from a phone app?
So right now, we don't support desktop calling. Right now, you can call from the phone app. You can use a Bluetooth headset that is connected to your phone. You can use one of our VoIP phones. In the future, we hope to change this and add different ways that you could be calling using Spruce, but that is still in the somewhat murky future of not having a meaningful timeline that I can give you.
Okay, perfect. Does Spruce have an option where calls can be recorded for training purposes?
Yes, we can turn on call recording for you. If you'd like to do this, write in on the Spruce support thread and let them know that you would like to turn on call recording. You'll see that we will send you kind of a block of legalese about recording that you need to express your approval of before we would turn on this feature for you, because in different places there are different restrictions on recording calls, and we want to make sure that you're aware of that and you're looking into that for your own practice.
Perfect. A follow-on question, is there an option of deleting internal messages?
So no, there's not an option for any individual message to be deleted by the user. This is actually a feature of the product based on HIPAA compliance. Spruce is part of the medical record. And so it's not possible for us to give you as the user the ability to delete messages. We, in terms of transparency, I think that actually this is a really important aspect of Spruce. When I was training receptionists, it's something that I often brought up to them, that the patient's thread is part of their medical record. And you should not be posting things internally in the thread that you would not want potentially to be seen by the patient in an instance where perhaps there was a legal issue in the future and that thread was being seen by the patient in a legal context. There should never be internal messages in the thread that are problematic from a medical perspective. It's simply not what that communication channel should be for. So I think in many ways, it's actually a great management tool because it helps all of your employees to really think about professionalism in their communication and understanding that putting something in writing matters. and should not be taken lightly. And, Spruce is not a great place for gossip. I have had clinicians say things on patient threads that were inappropriate. And it's really an important thing to be able to instill in everyone in your team that this is not a good place for that. If you do have a message that is internal or external that for some reason has to be deleted. For example, if you sent the wrong patient a message and it is clinical information that should not have gone to the incorrect person, please reach out on the Spruce support thread. We are able to delete that on the back end and make sure that we can tell you whether or not the patient viewed that message. So it is a really important fail-safe if that goes wrong accidentally. We're absolutely happy to do that for you, but it is not part of the user interface to be able to delete.
Perfect. Here's a question that just came in. We have patients that are very impatient. They call and hang up and call again. Can a phone tree be set up to help direct calls?
Yes, we absolutely can set up phone trees. This is part of our communicator level plan. So if you're not yet on the communicator plan, you would need to first upgrade to set up a phone tree. But we do have articles to step you through our process of setting up a phone tree and best practices in terms of the things that we found that work best. We generally find that if you have a very long intro message, people will hang up. So when you do design your phone tree, think about the patient experience, think about what you're hoping they're going to do, and keep in mind that we can always edit it again and change it for you if it's something that just isn't working for your practice.
Perfect. And then we just had a follow-on question asking again about clinician extensions. Is the phone tree probably the easiest way to do that as well?
Yes, if you want extensions, the phone tree would be the way to do that. Depending on the size of your practice, I think that the two versions of that we've seen are, if you have a smaller practice, you might have push 1 for administrative matters, push 2 for Dr. Jones, push 3 for Dr. Smith, push 4 for Dr. Clancy. And if you have a larger practice, then you might have a second layer to your phone tree. So you might have press 1 for administrative, press 2 for billing, press 3 for a directory. And then the directory would list out each of those clinicians and their extension, and the person would be able to choose from those.
Got it. Can a non-Spruce phone number be added to a phone tree?
Yes, a non-Spruce phone number can be an extension from your phone tree. The instance that we see this most is when practices are using something like an after-hours call center, and they want their after-hours phone tree to connect through to that call center. The thing to understand about this, which is very important, is that if the person who the phone is connecting to is not part of your Spruce account team, they will not be able to see missed calls or voicemails. They'll be able to answer the phone, but they won't be able to log into your account. So they won't see any information stored there. So if you have a call center where they're always going to answer the phone, that probably doesn't matter and is fine. But if this is a situation where you're connecting out to an individual and they might miss calls, that might be an instance where you would want to add them as a teammate to make that function better.
Perfect. And I think we have time. I'm just going to field one more your way, and then we'll start to wrap things up here. So final question, can you attach a document to a message on a mobile device?
Attach a document to a message? Yes, you can attach a document to a message. So if, for example, I was sending an SMS, or if I was sending a secure message from my phone, what I would see underneath the compose bar on the left is a little plus symbol. And that little plus symbol is for attachment. So you would be able to attach that way. I do want to stress that secure messaging allows for more file types and bigger files to be sent. And in general, we really encourage secure messaging if you're sending any kind of clinical files, because in that case, these are going to be securely encrypted for your patient as well as for you. And that's going to be a safer situation for them, and one that, you know, I think is worth promoting for your patients, for your practice, whatever it is that you're doing, whatever specialization you're in. So definitely a big fan of secure messaging. If you're not using it already, really think about getting your patients into it. Obviously, there are always going to be practices where they feel like, you know, my patients are not going to use an app. And if that's you and SMS is right for you, please use that. We're happy to have you use the product in the way that works for you.
Perfect. Yeah. Final note here. We've had a couple of folks ask about the UI, everything from colors to what about internal messages being yellow? It's hard to see when I'm outside. I don't know that that's so much a you thing, but I can certainly flag that for our engineering team. At this point, I don't think users have any control over customizing the look and feel of the UI, but that kind of feedback is always really helpful to us. And we are cognizant of that, and I will absolutely make sure that it's been registered after this event today. So thank you for that. And then a big thank you to Michelle for going over this incredible content. People are clearly very interested in everything that we shared today. And I know there are so many questions. If we didn't get to yours, you can absolutely reach out to support, because we're happy to answer anything. That resources slide, the Help Center can also probably address some of what you may have. But before we hit the top of the hour, if anyone is interested in joining us again on August 10th, we have another session, this time on maximizing productivity in any workspace. It just so happens that we're having an SF-based therapist, group practice owner, and writer podcaster join us to kind of unpack all that information. But I honestly think that the high yield information will be applicable to any specialty. So don't be dissuaded by the fact that it's specific to mental health here. We'll talk about effective tools that can help you maintain your practice. Again, kind of a nice segue from our session today. Proven time management tips, which I know we can all always use. How to scale a practice without having to work longer hours or hiring, and even when to make a lifestyle change. You know, maybe it's time to make a bigger move in your life. So be sure to join us if that interests you. I will include the link to that in the follow-on email that I send later today. So again, thank you everyone so much for joining. Thank you, Michelle. I think it's been a great session, and I hope you all have a great rest of your day.